Hey everybody, this is Dr. Kyle with ICE Clinics bringing you your next Tip for Tuesday. What I wanted to discuss today in our Tip for Tuesday is the idea and concept of proprioception and how that relates to our health. This is a concept that I talk a lot about with my patients because if you understand the idea of proprioception, you can really pinpoint as to why chiropractors are so effective at helping with a lot of different ailments. Proprioception is simply the concept that our brain has different awareness of our body parts based on sensory input through specialized nerve cells that we call mechanoreceptors. So I think mechanoreceptors help to relay information such as pressure or tension or any other degree of movement or stimulus that you can imagine through all your various body parts. And this occurs through your tendons, your ligaments, your muscles, and different components on the bottom of our feet or on our hands, the back of our elbows. So this occurs all over our bodies. And again, what this mechanoreception does is give our brain a stimulus as far as where our body parts are in space. So I can close my eyes, I know where my hands are, I know what my fingers are doing, I know which ways my arms are turning. I can describe this all to you even though I can't even see that. And that is done through this sensory input. But what I mainly wanted to relay is that we have three really concentrated areas of mechanoreceptors in our body. One is in our Achilles tendon, one is in our sacroiliac joints, and one is up in our cervical spine. And if you think about these three spots, this equates to a lot of common injuries that people experience. So think of foot pain or foot problems. Low back issues, which is especially common, and then obviously upper neck issues. So the point that I try and make to patients is that even if you don't have pain in any of these areas of your body, it's also very important to make sure that they're functioning properly, because if they're not, they could be causing you problems down the road in those areas or spill out to areas in the body that you have to compensate that will eventually lead to other issues as well. What I did want to reiterate today is of those three spots, so Achilles, low back, and neck, your upper neck is probably the most important spot as far as the function of your body is concerned. I tell some patients that if you could have any one spot adjusted on your body, it would probably be the upper neck. And what I wanted to show you, and I think I've shown you this chart before, so your upper neck primarily consists of C1, C2, and if you can imagine the bottom of your skull, which is called the occiput up here. But the neurology of this area, these are the nerve roots that come off the spine at this area. You can see they go to different components of the body. One of the ones that I really like to point out to patients, especially with C1, is our pituitary gland. So think hormone function, and then our sympathetic nervous system, which is essentially the fight or flight part of our autonomic nervous system. And if you cruise over just a little more, you can see there's quite a wide range of symptoms that many people struggle with. So anywhere from sinus trouble, headaches, chronic tiredness is a big one. But it just goes to show how important this area is of our spine and how we're kind of wired into its overall function. So lots of times when I'm cruising through a patient's history, I'm asking questions if they've been in a motor vehicle accident, if they had a concussion when they were young, sports injuries, all these things that better help to give me an idea where they might be compromised with their mechanoreceptive integrity. So one other little image I wanted to give you here is just the upper neck. Now I know Dr. Eric talked about this last week, but just to give you one more image, the C1 bone you can see is wider relative to all the other cervical bones in the spine, and it helps to cradle the skull, the occiput bone that I talked about. But the C2 bone, called your axis, acts as a pivot point for your C1 to work around. So the mechanics of this area of your neck are much different than the rest of your neck. And therein lies where a lot of the proprioceptive stimulus comes from, is how balanced these areas of your spine are. So for those of you that have taken the time to watch this and get to understand this a little more, I'm going to give you just a little quick take-home movement that you can do to kind of determine if you have upper neck dysfunction. So a lot of times we'll go through ranges of motion with our patients where we'll have them turn their head from left to right, what I want you to do when you turn your head from left to right is tilt your head backwards and then rotate from the left to the right. Usually you can feel a little bit of a restriction, like in myself. I feel like this is a little easier. When I go this way, I almost feel a little stuck, which tells me I probably need to be adjusted. But the idea is if you can pinpoint this dysfunction, much like I said earlier, whether you have pain or not, you might be able to tie this particular issue with a lot of other health ailments you might be struggling with. And that could be anywhere from sleep issues to anxiety, depression, and a whole host of other ailments, even including things like autoimmune conditions. So I would really stress for those of you watching this, try this test. If you see that there's any imbalance or dysfunction associated with that, try and find yourself a chiropractor. And if you do have a chiropractor, make sure that you kind of let them know and hone in on this particular area of your neck and the importance that it carries. A little long-winded, I know, but hopefully carries some good information for you guys out there. If you have any other questions, please don't hesitate to reach out to us. Again, I'm Dr. Kyle with Ice Clinics. Thanks for watching.